Well, federal health officials are still monitoring the spread of the Zika virus as new cases are being reported in Florida.
The CDC has issued a warning to pregnant women or those thinking of becoming pregnant to avoid unnecessary travel to the affected area just north of downtown Miami. Family physician Dr. Danoff joins us this morning with more on this and to answer some of our questions. Good morning, Dr.
Hi, good morning. Hi.
So let me ask you a question. What's the risk of this thing spreading out of Florida? I mean, pretty good, I would assume.
Well, the Gulf states are at the highest risk right now, and it's about 22 million people live in areas where these mosquitoes live year-round. So I would anticipate that this area will get wider for sure. They're looking at that. So it's not unheard of. There's other states that they're looking at further north, because there's a lot of people that travel to Latin America areas with Zika. They can come back, and then if they have the disease and most people don't show any symptoms and a mosquito bites them, then they become infected and can bite someone else.
Well, the CDC has issued a travel notice for this specific area in Florida. Talk to us about this advisory. If you have travel plans to visit there, what do you need to consider?
So it's about a 1 mile square area in the Windward section of Miami. Now, a lot of people in that area are from Latin America. So they go back and forth in these Zika infected areas. So naturally, some people have it. They don't have symptoms. A mosquito bit them. So that's the area where they've identified there is now Zika and local transmission. So they're advising any woman who is pregnant or any woman who wants to become pregnant, including having her male partner, they want to avoid that particular area right now and to just pay attention to the travel advisories.
What's the CDC recommending as far as prenatal visits then?
You know, it's interesting. All women who are pregnant, all women, doesn't matter if they went to that area, should be assessed when they go to their doctor. It doesn't mean tested, but they'll ask you a couple questions like, have you been to an area that has Zika? Yes or no. Has your partner been to an area that has Zika? Yes or no? So if the answer is yes, then they may be tested by a blood or urine test. If the answer is no, then they'll just monitor them. So all women who are pregnant should be asked these questions.
Now, currently there is no vaccine. So what about any additional progress or research on a possible vaccine?
You know, it's interesting you mentioned that. There's actually a company in Plymouth Meeting, Pennsylvania that has been approved by the government to start research and development on a vaccine. There's also 2 other pharmaceutical companies that are working on it, and they should start in September. But either way, it's at least a year to 3 years off, but they are working on it. They actually need a lot more funding right now.
Well, you know this story is going to continue to gain some steam over the next few months. We appreciate it, Dr. Rob, helping us answer some of those questions.
Absolutely.
Thank you.
Thanks for being here.
Appreciate it.